Everybody. I'm Greg Stanley. I'm here with Wes Warren. Today, we'd like to talk about how you can increase your case acceptance by 20% using almost any one of the ideas we're going to present. You present them all, it could just absolutely hit it out of the park. Wes, what have you seen in this area?
First, I want to say this is instantaneous 20%. This is not waiting 90 days and doing this or doing that. What we're going to talk about today is where you can absolutely change your results instantaneously. And Greg, yeah, there's a number of things. And and in your office, as you listen to them, you'll spot the one that you're weak in. Some of them you might be quite strong in, and some of them you might be relatively weak in. And you ought to be able to spot the one where you're weak in.
As we
Uh,
start out too, know that we are aware that if you push patients too hard, they might buy treatment, but they'll almost warn other people off on not coming to your practice. So keep in mind, all of that has been baked into this.
Yeah, you can push so hard, Greg, that you stop getting referrals. So a practice that was getting, 20 new patient referrals by other patients a month, all of a sudden that could dry up if your tactics are too aggressive. And so you absolutely got to be careful there. I would say, like, if I was going to create a list of the number one thing you can do to increase case acceptance, it would be with the doctor in their case presentation, how they deliver it and what they say, and more specifically, how they create urgency. This is the thing that can add 20%. When I say immediately, I mean the next day. In watching and listening to doctors and listening to the ones in the same practice, all in the office where we go and we listen to four doctors and listen to all their case presentations. And one's doing 150,000 a month and one's doing 75. There's a big difference between the two, and they're seeing the same patient flow. There's no actually the high producers actually seeing less. That's the funny thing.
Yeah.
The high producers actually, and this is a real story. I'm not making this up. I just went through this. Okay, the high producers seeing like 20% of the patient flow than the person at 75. And so you go in and you kind of listen to what's causing this. Why is this happening? And you listen to the word choices and things like that. So definitely one thing is just air of confidence. When you deliver the plan that's clear, concise, you boiled out all the options by the end, right? You say to them, look, if this were me, this is what I would do. And there's no ums or uhs. It's very, very directly given with a lot of confidence. And the other thing is the sense of urgency is there. When we listen to the other people, it's hemming and hawing. A lot of those waffle words you talk about, that you've talked about over the years, Greg. Waffle words are words like, yeah, maybe, or it could be, or might. Those are all words that are out of the presentation of these doctors that I see this big difference in. And absolutely urgency is created. The urgency is quite simple in most cases in dentistry. It's just about what we're trying to avoid, what consequences are with not following through with treatment. And they are delivered in a way that it is not rounded off, and it is presented in a way that's very clear. Hey, we don't get to this. This is what's going to happen. This is what's at stake. This is, and a lot of times we don't even catch it then, and you're dealing with implants, bridges, and things that cost $4,000 or $5,000. I wouldn't wait on this. I just wouldn't.
Wes, I've heard people say that if you're told a patient this can wait about 6 hours, they'd say, okay, I'll come back in 6 hours. In other words, they're kind of naturally defaulted to putting things off. So if you're not really clear with consequences, what happens if you wait too long? And what's funny? This is a hard thing to actually do. We're saying it like it's so easy, but in truth, you have to say it like, you got to get this done. You got to do it now. Here's the consequences. And somewhere through all of that has to come through that I accept whatever you choose. And you can do whatever you want, but these are your consequences and you have to live with it.
Yeah, that validity that you're talking about, that's basically what you're saying here is where you are valid no matter they say yes or no. And it's
Right.
very clear that you're not somehow, I won't say desperate because I don't believe our doctors
Right.
are desperate, but there is an encounter here that a lot of doctors will feel like, oh, they're on the back foot a little bit because, yeah, they get something out of it if the patient says yes. You got to really get rid of that, as far as your persona. If you've got to, hey, doesn't matter. It's no skin off my back if you do this or not. I just wouldn't wait. I know what's at stake here. The other thing is, these doctors are very good at reading the patient what they're ready to do. Meaning, this is a skill. It's not as easy, but a lot of doctors will overshoot. They will present a little bit too much, especially the ones that are struggling, like I'm talking about. The ones that are ringing the bell and getting great case acceptance and doing it on a fraction of the patients, they're able to know when to go big and know when to just say, hey, let's start right here. Let's just do this 1 tooth today and take it from there. Obviously, there's an ideal treatment plan. They should do all of it, but they have no problem just saying, hey, let's start here. Let's take care of this right now, and let's talk about these things, that these other things going on after we get this taken care of.
Let's go to another topic if you're open to it.
Yeah, yeah.
And that really is what I call the second opinion. In other words, the people you're talking about, Wes, who really seem to always get it right. They read the people right, et cetera, et cetera. A lot of times they have help you're not hearing about. Staff that know how to plumb the depths of how interested people are, how much money they're willing to spend. In other words, a staff person has really set the case up. What we've learned is that owner doctors benefit from having a great staff person doing all these things. On the other hand, associate doctors can't even survive without it, and it's essential.
I would put this in the category of that 20% absolutely that you're talking about. If you have somebody weak that is doing the pre-assessing, meaning before you walk in the room, if you've just got somebody just taking x-rays and hardly talking to the patient, there's 20% on the table absolutely by putting somebody in there that's really gifted with people, but talking about dentistry, pre-assessing it, and finding out, like you said, what the patient's budget is, as far as what they want to take care of. Today, that person's skill and getting the right person in that seat is worth 20%. Absolutely. It can make or break a marketing effort. So if you're marketing patients to the practice and you're driving in 15, 20 new patients a month through marketing, not having somebody skilled like I'm talking about there is the difference between the campaign like goose egging, where you almost get nothing, certainly not paying for itself, versus doing very well and wanting to spend more. It's that big of a deal. Their read on that patient and warming them up and talking to them about dentistry and the consequences, all the stuff you would do, but they've got 45 minutes to an hour to talk about it. You got 10, 15 minutes in most cases. And your mind is just got done with, you got to get back, and it's hard to just shift gears and read a patient. It's very difficult for you to do that. Where this person, no, they got a full 45 minutes to do that. You're getting the right person sitting there with a little training behind them of what they're supposed to do and the questions they're supposed to ask patients. It's worth 20% easy.
Wes, can I go back to that urgency topic that we introduced?
Sure.
And I'm not talking about creating urgency with the patient. I have seen, and I know you have too, practices where the doctors, a bunch of associates, they don't have any urgency. They're not motivated. They're not driven. They're just dragging around, telling somebody, oh, this is really important. Got to get this done now. Let's schedule you out 90 days. They're not motivated. They don't have urgency. And so if we can't get urgency coming from either the doctor or the staff as to, hey, let's get this done today. Let's get this done while you're sitting here. If we can't get that in play, I don't care what else you're saying, it just probably doesn't work out.
So, like, just dovetails exactly to what you're saying. I had listened to one of our doctors, who's a big time producer, and what he'll say to patients is like, he'll turn to a staff member. Let's see if we can't clear off a patient later today and get this taken care of later
Yeah.
today. Let's not wait on this. Where they're communicating to the team, this is urgent. We need to actually move some patients to take care of this one tooth now. Now, usually, like I said, most of the time we're talking about like a crown, $1,500, maybe 3 or 4 fillings max. Uh, where if you're trying to do this with quadrant dentistry, that's not going to work. It's hard to create this type of urgency where somebody's got basically a bombed out mouth that has obviously been waiting to go to the dentist for years, and now it's like, hey, we got to clear up the schedule. I've been avoiding the dentist for years. I think it can wait a day, you know. But with the one tooth or two teeth, this works beautifully. Where you create the urgency with your team member and you say, hey, let's try to clear off a patient and make some room on the schedule to get this done today. Boom. That you just created huge amount of urgency without even talking to the patient. These little, and yeah, they're tricks. Yeah, they sometimes, some doctors feel like it's a little, but unfortunately, patients don't want to do any of this. And if you slip up just a little bit, your results go down by a massive amount. And so using some tactics to get patients to do the dentistry they need, I think it's warranted. I mean, that's up for you to decide. If you don't believe they truly need it, that's fine, But I would definitely use as much of the arsenal as I could.
One other thing, Wes, something you mentioned earlier, but you really hit on urgency, but you passed over a little bit. You mentioned it, but we didn't develop it. Is the concept of clarity. Sometimes we find at the bottom of troubled practices where they can't close cases, they've gone in and talked about 9 different teeth and all of different levels of urgency, and the patient lacks clarity. These have to go together. And it really comes across when the staff person, the doctor, everybody's together on the same page going, yeah, you got 9 teeth that need to be looked at down the road, but there's 2 of them. I wouldn't wait to the end of the day. I'd get it done right now. That's clarity.
Right, absolutely.
And included in that would be the consequences of not getting treatment. So these are some things, and it's really, there's a lot of ways to mess this up, I suppose. Everything from associates that aren't motivated, staff that aren't motivated, even owner doctors that aren't motivated. A lot of different things can be wrong. My suggestion is, if you've heard what we've said and feel like maybe somehow we missed what's bothering your practice, or you would like to have us make this clear to you what's holding you back, get on the phone and talk to Wes and I. Let's talk through it. We'll show you where you're dropping the ball.
Yeah, if you don't figure this out, the practice is set where it's at. It's not going to grow. You can't afford to market. You can't afford to add team members, nothing. You've got to get pretty good case acceptance to really drive the practice forward, And I would want to add one more to the list, Greg, and that's a treatment coordinator. Same thing. So you got somebody on the front end, so that's your assistant or the hygienist seeing these new patients and pre-assessing for you. Then there's you, which is the most important, meaning you have the biggest impact. And you can record yourself and listen to it, and you'll spot the things that you're saying that, that was not good. And then, of course, the treatment coordinator, same thing. A person that has a sales aptitude, that enjoys the process, that knows dentistry. Those 3 pieces is how you get the biggest change. And having somebody that's slightly weak as a treatment coordinator, meaning they're doing pretty good, but they're not really ringing the bell. Finding somebody that can ring the bell It's 20% easy. So, and it is finding the right person. It's hard to train somebody up.
Yeah, when you get a mismatch there where they're not really naturally fitted into that job, they tend to burn out on it very quickly as they come under pressure. You know, Wes, you were in baseball, and I'm sure there was times when a pitcher threw some looping pitch down the middle, the ball was hit hard, and they counted on you to save the day in center field. That's
Right.
kind of what your treatment coordinator is. We do a mediocre job on the pitch for treatment, and we're counting on her to save the day. We really need everybody focused on this.
If you're sitting here going, oh, she's just not following up. If you're pointing to her as the problem,
Yeah.
typically it's not. It typically is not. It's you or your assistant or hygienist, the pre-assessment part.
How many times, Wes, do we see this where a doctor comes in and goes, let's have these ladies call everybody that was here in the last 3 months and get them in here for treatment?
That's
That ship is sailing.
you should follow up. I'm not saying you shouldn't follow up, but pretty much if they leave the office without scheduling, the chances of them following up and getting them on the schedule, you might get 1 out of 10. You might get 15%, but you might even get 20%. And they should do it, and most people do. And certainly the ones that they feel like are almost, they got to talk to their husband, they actually do follow up with those people. And to think that you're going to just call this big list and fill your schedule, I've actually never really seen that happen. Where we pull out the schedule and we just start calling, and magically the schedule fills. We get a few, but that's typically not the answer.
A sad thing, and it's probably happening to a lot of people hearing this, is after all it's said and done, what gets said and done is, let's get more patients in here. Let's get more marketing. In other words, let's get more people to show dentistry to. Well, there's nothing wrong with that. In reality, we had a doctor who spent the money on marketing. He was a prosthodontist. He was getting 0 out of 10, 0 out of 20, meaning people bought nothing out of 10 out of 10. Sometimes you can't even buy a hit. So this idea that I'll just get more people, you got to get good at the ones you got.
I can tell you how you've got false thinking on this. So if you're thinking, I got to get more people through the door because we're not doing well off the people we have, that's an indication that you should really look at case acceptance, and not really look after new patients. If you're saying, hey, we're doing so great, let's buy more new patients, then you're on the right track. If hey, we're killing it, we're just growing, we're doing so well off the patients we got, let's market and add more new patients to this flow, then that's correct. But if you're dying and struggling and, hey, we're not hitting our numbers, let's market more, maybe, that's not, I can tell you have an internal problem.
Right.
All right, so if you've got questions or you want us to look at your numbers, your practice, we'll certainly take a phone call from you. Go to our website and make a free consultation where you talk to Greg and I. We'll walk through your numbers and try to figure out the best way to increase your case acceptance.
Good.
All right, thank you.
Thank you.